So I guess that if we move to Hodgkin lymphoma, Hodgkin lymphoma is one of the most frequently cured with first-line treatment hematological malignancies. If we talk about, the treatment, I would say that it's quite homogeneous around the world. So we don't have a lot of different treatments in terms of first-line therapy. If I have to tell differences between US and Europe, probably in US the treatment is almost 100% based in ABVD as first-line therapy. In Europe, we have many countries that are using ABVD. As an example, in Spain, we are basically using ABVD, but you also have some groups and some countries that use a more intensive first-line protocol, which is BCOP escalated. So that would be one difference. Another difference is that probably the use of radiotherapy in Europe is more frequent than in US. So we know that the combination of radiotherapy and chemotherapy increases the long-term side effects of these patients that can be otherwise cured with the treatment. I still think that in Europe, basically for earlier stage Hodgkin lymphoma, and this does not apply to advanced stage Hodgkin lymphoma, we are still using more radiotherapy, and in US, basically to try to decrease as much as possible these long-term side effects, radiotherapy is avoided as first-line therapy and might be used later on. And I would say that in the relapse setting, autologous stem cell transplantation is still the standard of care. And I think that this is basically used in the same way in Europe and US. With respect to allogeneic stem cell transplantation, which is another strategy that it's basically dedicated to those patients that relapse after autologous stem cell transplant, the numbers of allotransplants have significantly decreased in US with respect to Europe. Although in Europe there are also differences between different countries and different regions with respect to the use of allogeneic stem cell transplant. Maybe in US there are more prospective clinical trials, and of course the healthcare system, it's basically private, where in Europe we have private systems, but also many countries where the healthcare system is public, and this has also to be taken into consideration with respect to the use of these so-called new drugs, which might be quite expensive. And I would say that another difference which is emerging in US and here in Europe we still don't have experience with that is the use of CAR T cells in patients with relapsed refractory Hodgkin lymphoma. So I guess that some centers in US and some patients have the possibility to use CAR T CD30 or anti-CD30 CAR T cells in the context of prospective clinical trials, which is not the case in Europe.